There are three stories breaking this weekend. One is a disease outbreak spreading across Central Africa with no approved vaccine and no approved treatment. One is 90 men dead in a coal mine that was already on a government danger list. And one is American consumers at their most miserable in 6 years while the stock market celebrates record highs. None of these stories are accidents. Every single one is the result of a decision someone made. Let's start with Ebola, because this is the story that's being covered the least aggressively relative to how serious it actually is. As of yesterday, there are 836 suspected cases and at least 186 deaths across the Democratic Republic of Congo and Uganda. The WHO declared this a public health emergency of international concern on May 17th. That's the highest alert level in global health, and it's only been issued 8 times in the modern era. The outbreak is caused by the Bundibugyo virus, a species of Ebola. And here is the number that should stop you cold. There is no licensed vaccine against it. None. The vaccines we developed after 2014 target the Zaire strain. This one is different. Case fatality rates in past Bundibugyo outbreaks have run between 30 and 50%. An American healthcare worker who contracted it while treating patients in DRC has been evacuated to Germany for treatment because Germany has more experience managing Ebola patients than the US. His high-risk contacts were also flown to Germany and the Czech Republic. The US response, announced Thursday, is to invoke Title 42, a public health authority last used aggressively during COVID, to ban entry to non-citizens who have been in DRC, Uganda, or South Sudan within the past 21 days. And as of yesterday, HHS went further. The ban now extends to green card holders. Lawful permanent residents who have been in those countries cannot currently enter the United States. This is where I have to be direct about what's happening here, because the press coverage is not being direct enough. The WHO has long advised against broad travel restrictions in Ebola outbreaks. Their evidence base goes back to 2014, as Dr. Crude, an infectious disease specialist, told ABC News yesterday. A broad travel ban does not make sense based on the epidemiology. You design policy around exposure history and clinical symptoms, not nationality or immigration status. What travel bans actually do is push infected travelers underground. They rebook through third countries. They avoid telling airlines the truth. You lose your surveillance visibility precisely when you most need it. And the Bundibugyo numbers are almost certainly undercounts. The WHO said explicitly at their May 20th briefing that given the time the virus was circulating before detection, they expect reported cases to keep climbing. The outbreak has already spread from rural Ituri province into Bunia, Goma, Kinshasa, urban centers. Cases are confirmed in Uganda's capital, Kampala. This is not contained in a forest. It's in cities. The US has no effective treatment to offer, and a travel ban that experts say will backfire. We are watching the world's most powerful health bureaucracy reach for the most politically legible tool available, and hoping it works. Now China, because 90 dead workers and a falsified mine blueprint deserve more than a paragraph. Friday evening, at 7:29 p.m. local time, a gas explosion ripped through the Liu Shenyu coal mine in Qinyuan County, Shanxi Province. 247 miners were underground. At least 90 are confirmed dead. More than 120 others were hospitalized, with 4 in critical or severe condition. 9 miners were still unaccounted for as of Saturday afternoon. It is China's deadliest mining disaster since at least 2009, possibly 2007. Reuters, CNBC, CBS News, and The Washington Post all covered the basics. But CBS News buried the detail that actually explains how this happened. The blueprints provided by the Liu Shenyu mine company to rescue teams did not match the actual underground layout. Rescue operations were hampered because the map of the mine was a lie. One hospitalized miner described smelling sulfur, telling people to run, and watching colleagues choke on smoke before he lost consciousness. A survivor's account. The state broadcaster CCTV aired it. And sitting underneath all of that is this fact. First reported by CBS. China's National Mine Safety Administration placed this mine on a national list of disaster-prone sites in 2024, specifically because of high gas content. Think about what that means. The Chinese government identified this mine as dangerous, put it on a list, and 247 men were still sent underground. And the company that operated it gave rescue teams a false map. President Xi Jinping called for spare-no-effort rescue operations and strict accountability. Premier Li Qiang demanded transparent information release. The executives of Shanxi Tongzhou Group have already been placed under control, meaning arrested or detained. This is China's standard playbook after industrial disasters. Arrest the individuals, satisfy the demand for accountability, leave the structural incentive system. The safety inspection gaps, the documentation fraud, entirely intact. It happened after Heilongjiang in 2009. It happened after Chongqing in 2013. It is happening again now. Shanxi province is China's coal heartland. China has dramatically reduced mining fatalities since the early 2000s. That's a real achievement. But reduced is not solved. And a mine on a danger list with falsified blueprints, with 247 workers underground, producing 1.2 million tons annually, that mine did not become dangerous last Friday. It was dangerous for years, and the people in charge of that decision are not the ones who died in it. And then there's this. While China buried 90 workers and the WHO was scrambling for containment tools it doesn't have, Wall Street had one of its best weeks of the year. The Dow Jones closed Friday at 50,723, an all-time record. The S&P 500 equal weight also hit a fresh all-time high. Markets have been rallying all week on optimism about Iran's ceasefire progress, and the Atlanta Fed's Q2 GDP Nowcast was revised up again, now sitting at positive 4.3%. On paper, the American economy looks extraordinary. And then you look at the University of Michigan Consumer Sentiment reading that also came out Friday, 44.8. That's the third consecutive monthly decline, the lowest reading since the depths of the 2020 pandemic. Both the current conditions index and the expectations index fell together, and consumers cited the same two things: the cost of living and inflation. The Schwab Weekly Outlook noted that consumer confidence has been lousy, that's their word, while simultaneously reporting that the Dow set a record. Brent crude is at $105.47 this morning, up nearly 3%. That is not a sign that the Iran situation is resolved. That is the oil market pricing in continued uncertainty about Hormuz. And yet equity markets are celebrating. The manufacturing PMI hit 55.3, the highest reading in 4 years, while the services PMI softened and consumer sentiment collapsed to pandemic-era levels. Here's what's actually happening. The people who own financial assets are having a great year. The S&P is up, the Dow is at records, and the Atlanta Fed's GDP model says the economy is growing at over 4%. The people who buy groceries, fill gas tanks, and pay rent are in their third consecutive month of declining confidence, and they are as pessimistic as they were when the world was locked down in 2020. This is not a contradiction. This is the structure of the economy accurately reflecting itself. Asset inflation and consumer misery are not opposites. They are two sides of the same dynamic. When central banks maintain loose conditions long enough, when oil prices stay elevated, when wages don't keep pace with the cost of living, you get exactly this: records on Wall Street and despair in the University of Michigan survey. Nobody in the financial press is connecting those two data points in the same breath. Schwab leads with the Dow record. The consumer sentiment miss is paragraph 3. That ordering is not accidental. 3 stories. A disease we have no treatment for spreading through African cities. A mine on a government danger list that killed 90 men. And a market hitting all-time highs while the people living under it feel worse than they have in 6 years. The question I'd leave you with is this. In each of these cases, the warning signs existed before the outcome. The mine was flagged in 2024. The Bundibugyo strain's vaccine gap has been known since 2007. The divergence between asset prices and consumer confidence has been building for 2 years. At what point does "we knew but didn't act" stop being an explanation and start being a policy?